which is about the sustained drug release system. So the newer modes of drug delivery, basically. So now the issue is with adherence, persistence, compliance, etc. So there are a lot of these newer techniques of drug delivery. For example, punctal, subconjunctival, anterior subtenons, suprachoroidal, posterior subtenons, even subretinal, intrascleral, and phonics delivery systems. Now, there are these technologies which are now booming. One is something referred to as 3D printing, and the other is nanotech. So these are not new technologies. These have been there for years, for 30 years or 25 years. But what is happening is, with the evolution of these technologies, now they are at a stage where they can be used for the eye. So because you have 3D printing, you have developed these drug delivery systems where the drugs can be delivered intracamerally or subconjunctivally or in the punctal spaces. And MIGS owes its success to the 3D printing, because almost all these systems that you have, they have used 3D printing technology. So in case of these patients who are a vast number, the early glaucoma cases who are on monotherapy, you can have these delivery systems, the subconj, punctal, or the external ocular inserts. And for patients on multiple drops, you can have these sustained intraocular drug releases. So it caters to both. For example, the early glaucoma cases, you can use these. And for the moderate to the advanced glaucoma cases, you can use these so that you can reduce the number of topical meds. So let's look at, I'll just quickly run through these 7 systems. 1, the external ocular inserts. 2, the punctal drug delivery systems. 3, drug-eluting contact lenses. 4, microneedles. 5, subconj implants. 6, nanoparticles. And last, the intraocular inserts or the implants. So the external ocular inserts, they have been there for a long time. So one of the earliest ones was something called OcuCert, which used to deliver pilocarpine. So it was either 20 micrograms per hour release for 7 days or a 40 microgram per hour release for 7 days. Apart from that, we are all familiar with the bimatoprost ring and something known as the topical ophthalmic drug delivery device, or TODD. So it's basically like a contact lens. However, it doesn't sit on the cornea. It is placed in the fornix and it can be impregnated with a drug. For example, 3 milligrams of timolol and 600 micrograms of latanoprost. So these give you a long-term sustained drug delivery. Something else called NODs. These are the newer ophthalmic delivery systems where you have a handle, paper and a film, and the segment which contains the drug, it detaches from the carrier and gradually dissolves, releasing the drug. So you have the advantage of a preservative-free drug with a longer corneal contact time. This is something called SODI, which was developed by the Soviet scientists, cosmonauts, who could not use the drops in weightless conditions. So these release the drug either by diffusion or osmosis or bioerosion. And you have these newer things which are called micro machines. So these are referred to as micro electromechanical systems. So these are again currently in the phase 2A trials. So what you have is, you have a small drug reservoir and you have these wireless heating coils and a thermal sensitive hydrogel. So the drug remains here. When the heating elements are activated, the hydrogel valve contracts and the drug is released. So basically you have this, thank you Dipanjana for coming. So you have this drug delivery system, the small machine which is fitted on top of the sclera, and you have the drug delivery inside the eye. So it can be auto-regulated with the help of your mobile phone, or you can have it manually. The next group, the second group, are the punctal drug delivery systems. Now things are moving so rapidly. So there were these 2 companies which were there. One is by Ocular Therapeutics, which used to manufacture OTX-TP, which released travoprost. The other is by the company called Marty Therapeutics, which manufactures Evolute OR. However, surprisingly, Ocular Therapeutics has discontinued this. So basically now the only one you have is the MARTI therapeutic delivery system. So what was there in the ocular therapeutics was a hydrogel. So you have a small hydrogel which was implanted into the punctum, and it gradually released the drug into the tear film. The Evolute by MARTI Therapeutics, basically what this has is a drug eluting core, and you have this proprietary plug. So this plug allows the flow of tears into the NLD, and the drug has a one-way valve to extrude into the tear film. So this is something which MARTI is really working on, and it's not just about glaucoma drugs. So you have Evolute allergy, you have Evolute anti-inflammatory. So in post-cataract surgery cases, probably you won't be needing drops in the future. In allergy cases where you need a sustained delivery, probably something like this could work all through the day. Drug-eluting contact lens, again, nothing new. You can have a lot of varieties. You can either have a soak and release, where a polymer is there which has the drug impregnated in it. It will gradually release the drug. 2, you can have a film impregnation contact lenses with molecular imprinting. 3, you can have an enzyme triggered drug release, for example, timolol and lysozyme. And 4, you can have the nanoparticle loaded contact lenses which gradually elute the drug. So this is the contact lens drug mode. Something a little bit new is called microneedle drug delivery system. So these are basically used for drug delivery to the skin. So patches on the skin. So you can have silicon, glass, metal, ceramic, sugar, or polymer microneedles. For the use in the eye, what you have are these detachable microneedles. So basically, it attaches onto the surface of the cornea, and then the core remains. Either the whole needle remains or just the covering of the needle remains, and gradually it elutes the drug on the surface. You have 2 companies which are manufacturing subconjunctival implants. One is a company called BioLite, which has a product called ID. So this gradually releases latanoprost over a 12-week period. And the other is a company called Greybug. Now, the Greybug is a giant. If you look at the shares of Greybug, those who are interested in shares, it is doing a lot of work on AI and these subconj implants, so something new. So basically, what it is doing is it implants a pro-drug, which gradually becomes a drug. So you can have either a IOP-lowering drug and an IOP-lowering drug combo, or an IOP-lowering drug and a neuroprotective drug combo. So these are subconj implants. Again, nanoparticles, like I mentioned, it's nothing new. It's been there for around 25 years. So you have these nano drug delivery systems where either the drug is entrapped as a nanoparticle, or it's an encapsulated nanoparticle, or you have these neosomes, or you have these dendrimers. So these are sustained drug release preparations. You already, a lot of people may be using latoprost RT, which is actually this, a drug-loaded liposome. So it kind of gradually enhances the drug delivery. So you have these brinzolamide loaded nanoparticles, or you have these liposomal latanoprost. So something which we use in cooking, which is the black cumin seeds. So there is a particular drug in it which is called thymoquinone. So now some of the companies, they are having liposomal latanoprost or liposomal thymoquinone, or a combination, latanoprost and a thymoquinone combination. So these are basically injected subconjunctivally. So you inject them, it remains for 90 days, gradually elutes the drug. So what they say is that the hyperemia, etc., are less when compared to a person on topical latanoprost for 90 days. And last but not the least are the intraocular implants. Like I said, print technology or 3D printing, it has enabled us to have these molds. So you can have these drug molds deliver these particles, and you have these injectable systems where it puts the drug into the intracameral space, and gradually the drug elutes over a period of time. So this is a company called Envisia, which manufactures something called ENV15, which is a travoprost. You have a drug from Glaukos. The only difference with the drug from Glaukos is it's a titanium implant. So here, the drug is gradually released. You have to remove the implant, and you have to re-implant a fresh drug after a 6-month period. You have the bimatoprost SR, which is the Durista, which at the moment, the Durista has been FDA approved. It got the FDA approval on 5th March 2020. So it's a pellet designed to release bimatoprost over a 4 to 6 month period. So a lot of studies have been published showing pretty good results. And like I mentioned before, Ocular Therapeutics, which has the punctal delivery system also, they are coming out with a number of drug delivery systems which are intracameral, be it in ARMD, be it in glaucoma, be it in dry eye, be it in ocular allergy. So basically you implant the pellet, gradually over time the pellet is going to reabsorb because it's a biodegradable implant. So all these newer drug delivery systems, be it external ocular inserts like the bimatoprost ring, the punctal drug delivery systems, the drug-eluting contact lenses, microneedles, subconj implants from Graybug or BioLite, nanoparticles, or intraocular inserts. All these are going to play a big role in the near future. Thank you. So I'll directly move on to the next talk by Vineet. So, I when I was putting this IC together, I put up these minds from different parts of the country. Vineet is a fresh young mind and he's doing a phenomenal work, be it on ocular blood flow, be it Vineet is the one who inspired us to get the MP3 laser. But then, like Satya sir was mentioning, problems